that if you don't get any medicine, how can you treat patient? No, the topic is not for that. The topic is for, we are hearing so many times that I am not getting this particular medicine. This particular medicine is required for my treatment, but I'm not getting that medicine. Why I'm not getting that medicine? But even sometimes it happens that I get the medicine, but after giving that, I'm not getting the desired result out of that medicine. Why this is happening? My topic of discussion today will be around this. Why we are not getting all the medicines we require. And even if we get some medicine, sometimes it happens, it is not acting properly. Why? The problem of homeopathic pharmacy is where to get genuine drug substances to prepare the medicine. That means the homeopathic pharmacies are not getting always drug substances, genuine drug substances to prepare those medicines. You will be astonished to hear why it is so. Let us see. You know, our drug substances for preparation of medicine includes from botanical origin, drug substances from animal origin, drug substances from mineral origin, from synthetic chemical compounds, nodules, sarcode, and imponderabilia. Out of all these, the drug substances of botanical origin occurs almost 65% of the total material. Animal origin covers something like 15%, mineral origin is something like 15%, and nodules, sarcode, and imponderabilia, they're also occupying something. Let me start with drug substances of botanical origin. What is the problem? Raw material of botanical origin. Guaiacum, a very important medicine of Metromedica. For long, people are asking for guaiacum, mother tincture, but they're not getting that. Why? You see, guaiacum is prepared from the resin obtained from the wood of guaiac tree. You see, guaiac tree is a very large tree, almost 70 feet high or even more. Grows in northern part of America, USA. It is known as a rough bark lignum vitae. It is known there and this name. And it was listed as an endangered species by IUCN in 2019. IUCN means International Union for Conservation of Nature. It has been described to be endangered. It has been overexploited for its valuable wood and medicine products. And international trade of this species is now restricted because of its placement in CITES Appendix 2. CITES means Convention of International Trade in Endangered Species. They have said that you cannot trade with guaiacum, any product from guaiacum. That's why guaiacum resin is not available anymore. It is available in the USA. A small quantity is available in the USA, but we are not in India. We are not getting, because export of that from USA is totally banned. That's why. Where from you will get that guaiacum? You may get some guaiacum in the name of some resin in the name of guaiacum here in India, but you'll find that every sample is adulterated with other resins, adulterated with colophony and all those things. And if you prepare medicine out of that, that will not give you a good result for guaiacum. This is the picture of guaiacum tree. And for bringing out the resin, the whole tree is to be cut. And the logs are to be carefully heated by fire when the resin contained in the wood oozes out from the cuttings. That means you have to cut down the tree, heat the log to get the resin. And that's why the whole tree is lost. Guaiac resin finds many use, and for that reason, man has already destroyed so much tree that it is now in endangered plant list. And by CITES, felling and trade of guaiac tree is controlled. There's a problem with guaiacum. No genuine guaiacum resin is therefore available now for preparation of a medicine. The story of hydroxys is of no different. This is the hydroxys plant. We require only this part of this plant, that is this rhizome and root, mainly root. If you take out the plant and take out the root, the whole plant is lost. The plant was in the list of endangered species. However, due to effort of naturalists, number of hydroxys plants grew during the last decade, and it has recently come out of the CITES list. But still, it has become very expensive. The price of plant is skyrocketing, and at present in our country, landed cost of genuine hydroxys root is around rupees 45,000 a kg or even more. Can you think, if we prepare the mother tincture out of this hydroxys root for costing 45,000 rupees a kg, from 1 kg you will get hardly 900 ml of mother tincture. So that 900 ml of mother tincture will cost of drug is 45,000 and other cost will be almost 45,000. That means 90,000 rupees per 900 ml. Who is ready to pay that? That's the problem. Still, it is still available. Only little is available. Mother tincture is available, but at very high cost. Let us take the case of camphor, an important drug of homeopathic materia medica. We all know that should also be prepared from natural camphor and not from cheap synthetic camphor. Is it wide difference between natural camphor and cheap synthetic camphor? Though as per chemical formula they are the same, but they are not the same by structure. We require only the natural camphor for preparation of a medicine. This is the camphor tree. Camphor is, we get camphor out of the wood of the tree. Natural camphor is obtained from distilling wood of camphor tree, which usually grows in Japan. And cutting of camphor tree is now restricted. Because if we cut down the tree, it will be extinct. So cutting of camphor tree is very restricted. So where from our future supply of natural camphor will come? I don't know. Now let's come to raw material of animal origin. Let us take the case of cantharis. For long, we're not getting even a single fly of cantharis. Cantharis is a very useful medicine according to the materia medica. But cantharis is extinct right now. What to get cantharis anymore? Cantharis fly, Lita vesicatoria, is almost extinct. And a totally different fly, Mylabrys, is now being used in the name of cantharis. This is the Lita vesicatoria picture. This is a Spanish fly, green in color, about half-inch long, available only in middle and south of Europe, especially in Spain and Portugal. This is a picture of cantharis, that green fly. The picture is in black and white, and this is the actual picture of cantharis, that green fly. But the picture was taken in 2003. After that, we are not getting a single fly. Instead, this very fly, a Mylabrys species, black and yellow striped fly, available in India itself, in Odisha and in West Bengal, Midnapur district of West Bengal, it's available there also. It is being used in the name of cantharis. I'm telling you, 100% of the manufacturers who are manufacturing cantharis mother tincture are using this one. Is it good to use this fly in the name of cantharis? I'm telling you one interesting story. When we were not getting getting cantharis from Spain. We are searching in the Europe, other countries, if we can get cantharis. One German supplier told us, yes, we can give you cantharis. And yes, they fine. We require a lot. Can you supply? Well, yes, we can supply you in terms of in pounds or in terms of any quantity. And please send us some sample. They sent us a sample. And what we find, that this very Indian fly, they're supplying in the name of cantharis. We told them, what you're doing, you are importing this from India and exporting this again to us. Is it cantharis? Oh no, it contains cantharidin, it contains cantharidin. You can use that also in place of cantharis. But you, the physicians, do you think, can we use any other species, any other fly, any other insect in place of cantharis? And if we do that, should we get desired result? Definitely not. And this is the reason why sometimes we're not getting result using in medicine what we get. Plata orientalis, a very common insect, everywhere it is available. From Kashmir to Kanyakumari, everywhere it is available. Why I'm talking about this? If you go to the market, ask for blata, you'll get sack full of blata. But mind it, how to ascertain that they have not been collected after spraying with insecticide and then dried? You'll get them only in dry condition, never in live condition. Because getting blata in live condition is very difficult, collecting blata in live condition is very difficult. Yes, we are collecting blata in live condition, but we're getting only small quantities at a time. And that's why our production planning is hampered. But still, we cannot use dry blata available in the market, as because you can be rest assured that when they go down for blata leaves, they're spraying with insecticide, sometimes they're spraying inside, sweeping out the dead blata, and they're putting it in a bag and giving you that blata. Let's think about sepia. Sepia should be prepared from dried black ink secretion contained in the oval pouch, near the size and shape of the grape, found in the abdomen of cuttlefish. This is the picture of the cuttlefish. But there are so many species of cuttlefish. We don't know sepia taken out of which particular species was employed in pruning. Secondly, this ink, they contain this ink for their self-defense. We'll try to catch this sepia. It will spray out that ink. You won't get sack full of ink. Very difficult to get that. And if you can get that, it should always be collected with the pouch for preparation of medicine. Sepia ink was available previously in the market for painting, but that is not our sepia. But sepia is a different thing. Our sepia should be collected with a pouch of the sepia full of ink, then it will be dried, and after that medicine is prepared out of that. But there are many species of cuttlefish, I told, available with species required for collection of ink, and the ink sac will be taken out of the fish quickly to avoid deterioration. Another interesting example is nephritis. Nephritis is obtained from the anal gland of skunk cat, available in northern part of America only. This is a picture of the skunk cat, available in the northern part of America. For getting the secretion of the anal gland, wild cat is to be killed instantly while trapping. Usually a guillotine type instrument is used for that purpose. If you don't kill that immediately, cut the head immediately, it will emit and spray the poisonous fluid for its self-defense. And after that, we'll get only the dead body of the cat. We'll not get that fluid that required for preparation of medicine. Do you ever thought that how difficult it is to get proper drug substance for preparation of a medicine? The cat is becoming extinct, and for its preservation, killing of the cat is now prohibited. So, how to get nephritis anymore? I don't know. In future, how can we get nephritis? Apis mellifica. What's the problem with this? Honeybee, available everywhere. They've been cultivated for getting honey. Wild bees are available. Why I'm talking about this? But mind it, have you ever seen a person as a bitten with apis or honey bee in the, rainy season or in the autumn? No, you don't find. You'll find that bees attack person, especially in winter and spring, and sometimes in summer. As because at that time honeybees are most active, and poison is to be extracted in a very peculiar manner of the bee. If we get dead bee, it will be of no use to us, as because we cannot extract the poison out of that bee. A very special technique is there, and for getting that good quality of poison, virulent bees are essentially required for preparation of medicine, and that is to be collected alive, in live, absolutely live condition. No dead bees required, only live bees. They were allowed to bite on the vessel, to spray the poison on the vessel, and that poison is to be collected and prepared for medicine. Now, leaving apart botanical and animal origin, let's come to raw material of mineral origin. Hekla lava. We see in the market so many medicines, so many cosmetics are said to be prepared out of Hekla lava. Everybody is saying that they're using Hekla lava, sometimes 1x potency, sometimes 3x potency. But as frankly speaking, I don't know where from they're getting that Hekla lava. The very fast thing you must understand that the Hekla lava is not at all a lava. The proving was done with fly ash, not with lava. And that fly ash came out when Mount Hekla of Iceland erupted some 150 years back. Is it possible to get that fly ash right now? It was collected at that time. Medicine was prepared out of that. Medicine was very active medicine. But if we ask for that fly ash, where can we get that? Literature says finer ash which fell on the pastures of distant localities was particularly deleterious, while the gross ash near the mountain was inert. Forget about lava. The gross ash is also inert. Only the fly ash, finer ash, that fell on the pastures of distant localities, they were collected and medicine were prepared out of that. How the manufacturers, I don't know, where from they're getting that fly ash anymore and how they're preparing their medicine. This is Mount Hekla. It's a Mount Hekla. Now, where to get this fine ash nowadays? And if it is not available, how to prepare the potencies? Another example, Carlsbad salts. It is to be prepared from the residue of a lake of Carlsbad in Germany. The medicine is prepared out of the residue collected from the lake. The lake has dried up for long back, and material is no longer available. At that place, it is being cultivation work is going on. And still, we are saying that we are preparing cultivar salts, medicine. I don't know where from are you getting that medicine. And these are the reason why you use medicine out of this faulty raw material. You would never get result of that medicine. And the people will say, your homeopathy is nonsense. Homeopathy doesn't work. But if you can get the right medicine, still now you can say, yes, homeopathy is very, very active. Homeopathy definitely homeopathy works. Now let's come to synthetic chemical origin of raw material. You must think that with synthetic material origin, raw material, there should not be any problem, as because those are prepared by men. Yes, those are prepared by men, no doubt. But uranium nitricum is very good demand for uranium nitricum lower potencies. A good medicine is used in diabetes patients. What is uranium nitricum anymore? It is totally banned item. Uranium is totally banned item. No, you'll get uranium nitricum anymore. Chrysarobinum. At one time, it was used in the allopathic pharmacy, allopathic medicine. They stopped the use of that long back, and after that, manufacturers also stopped preparation of chrysarobinum. Arsenicum iodidum. This preparation, these things have stopped long back. Now we are with the homeopaths. We are making medicine out of these things. Where from we will get these medicines? Either we shall have to prepare them in our own laboratory. If we can do that, only then we can prepare that. But preparation of these things is difficult. Of course, it is difficult. Yes, they can be prepared in the laboratory, but in small scale preparation is not difficult. That's because in homeopathy we require only some kg quantity of this medicine. And if you go to the manufacturer, they'll say, how much ton you require, only then we'll be interested that this is for you. Even our very common medicine, what we use, say for example, ferrum phosphoricum. I think all the homeopathics are use ferrum phosphoricum sometime or other. They require ferrum phosphoricum in plenty. Yes, ferrum phosphoricum can be prepared in the laboratory. But if you go to the market, ask for ferrum phosphoricum, you'll get a medicine, a raw material. That color is green. But mind it, ferrum phosphoricum color is not green. Its color is blue. It should be prepared in the laboratory or ready use. If you keep that material for long, it will lose its color and its chemical composition also alters. And that altered chemical composition material is of no use. You shall have to prepare this thing in the laboratory. The manufacturer should prepare in the laboratory, and after that, they should use that immediately. Say, for example, mark salt, mercury solubilis. It's not available in the market. In the market, if you go, you will get something else in the name of mercury solubilis. It is to be prepared in the laboratory, your own laboratory, for preparation of medicine. And that preparation should also be done as following very, very strict principle as was prepared by Hahnemann himself. The preparation method is given in his book. And only if you can do that, you'll get correct type of, mercury solubilis. And if you prepare medicine with that, that medicine will work. Otherwise, it will not. Now, let us enter a very difficult part of this discussion. Raw material of rosewood origin. I'm telling you straight. In future, you won't get any medicine prepared of nodular origin, made of nodular origin. Why I'm telling this? Problems related to procurement of drug substance of nodular category are manifold. First of all, let us see what is a nodule. Generally speaking, nodules are diseased gland or secretions thereof, or even bacterium or virus that causes a disease. We prepare our medicine out of these things. That means we collect either the disease gland itself or the secretion out of the disease gland and potentize that. Or you may collect the bacterium or virus and potentize that. There is a method of potentization, we may potentize that. But do you think the problem of collecting disease gland or secretion? However, I'll go to later. Let us see what is also I want to see here. In the books of in Allen's nodules, you will find that Sickle cornatum, Astilago medis, these have been described as nodules. But are they really nodule? They are fungi of botanical origin. They should not be categorized as nodule. And you can get medicine for this. If you collect the fungi, you can prepare medicine out of this. In Allen's book, it is said that cholesterinum, laccaninum, magnetic ambo, they are also nodules. It is categorized as nodules. But that truly speaking, they are not nodules. Cholesterinum is a pure chemical compound. Cholesterol is available in our own body also. A pure chemical compound. Laccaninum is milk of beech milk. And manganese polyambo is also mineral. They are not at all nodules. But unfortunately, it has been categorized as nodule in Allen's medical nodule. However, let's come to true nodules. These are true nodules are carcinosin, medurinum, sicilinum, bacillinum, sorinum, tuberculinum. I missed here the name of sorinum. When I should come first, as because sorinum is the oldest nodule, and that nodule is prepared by Hahnemann himself. But the problem lies here even. How to prepare nodule? Let's look at the literature. What literature speaks about preparation of nodule. Tuberculinum. Tuberculinum was prepared from sputum of phthisis affected person. If we wish to prepare tuberculinum now, you can get phthisis affected person. If you take the sputum and prepare a medicine, tuberculinum, with that sputum, will that be identical to the tuberculinum prepared earlier? It will never be identical. There is no question of any matching even. As because the person you get a TB affected person, if you can find one, he has been treated so many times with so many medicines, and his sputum has changed its all characteristics. That tuberculinum prepared some 150 years back, or even more. The proving of that material and proving of recently prepared tuberculinum will be totally different. So how can we prepare tuberculinum again? Bacillinum. The best way to get really good bacillinum is to take a portion of lung from the parietes of cavity and in circumstance tissues of an individual who had died of genuine bacillary tuberculosis pulmonale. Is it possible to get this thing even? Sorainam, what I'm talking about, the oldest nuzur, prepared even by handyman. Just look, handyman prepared advocated to use this seropurulent matter medicine by method trituration. And he took the seropurulent matter coming out of the scabies affected person, took that with lactic potency, then ultimately that has been potassed. But almost at the same time of handyman, Herring prepared the same medicine. And what he said that medicine was prepared from of yellow pastel present on the scabies affected finger joints by succussing the same enamel. Difference, a very wide difference. The Soraina was prepared by Hahnemannian process, by Herring's process. We don't know. If we prepare any medicine right now, we shall have to keep good record how we are collecting this medicine raw material. How will portray that, and what proving we shall have to prove it anew. After proving, only proving, you can use that medicine. Syphilis. The literature says that this is prepared from syphilitic poison. What is syphilitic poison? I don't know. Is it a pus or isolated Trichonum pallidum bacteria? What was used? Literature is quite silent about that. What was used originally? What was syphilitic poison? It said only to say that prepared out of syphilitic poison. The same case is medurinum, prepared from gonorrhea virus. What is that thing? Is that the pus? Isolated gonorrhea or gonococci? The literature is absolutely silent about all these things. But just think how we can prepare these nuzurs anymore. Let's come to the very recent, almost new nuzur, carcinosin. You are using widely carcinosin in many diseases. But truly speaking, we don't know how that carcinosin was collected and how medicine was prepared out of that. Carcinosin was proved by Templeton. The proving of carcinosin by Templeton as given in Fubister's carcinosin drug picture, where he said very clearly, even with the present substance carcinosin, its source is unknown to Nelson, who have supplied our material. That means Nelson supplied the material to Templeton for proving. All they can see is that it comes from USA. The materials came from USA, but we ought to know the source of remedies. What thing came from USA, nobody knows. In the case of repertory, in the case of Materia Medica, carcinosin has been mentioned. There also is mentioned it's out of breast, cancer-affected breast, but it's not mentioned there whether the secretion was collected or the whole gland was collected for prevention medicine. How the present day people, present day pharmacists, they're preparing carcinosin. What is the literature? There's no record. What my suite will say that do it in this way. I'm doing that and I'm giving you medicine in that way. Is that good for homeopathy? Is that good for medicine? It will be helpful to note that more than a dozen different carcinosin preparations have been made from material obtained from operating theatre of Royal London Medical College. Because of this problem, from Royal London Hospital, they tried to prepare carcinosin. Of these, only 3 had been clinically used when the first paper was read in July 1958. 4 more have now been satisfactorily tested clinically. And what are those things? Carcinoma adenostomach, carcinoma adenopapillary bladder, carcinoma bowel, the composite thing, carcinoma serous, the breast. Probably this is a carcinoma, most probably. Carcinoma squamous is out of lung, and carcinoma of earlier origin. They tested all these things, they prepared all these materials separately in separate name of medicine. If you ask, you require carcinosine adeno, yes, you can get that. There's good record how they prepared that. But if you say you require carcino, I don't know. There's no good record there for it has been collected. It is collected from carcinoma serous. How to prepare nozodes? Present the idea about preparation nozode. Because of this problem, a big controversy is going on for long. How to prepare nozodes? Again, nozodes can be prepared in 4 ways. Either from diseased tissue or excretion of diseased glands or tissues, used directly as drug substance. Earlier that has been done. Bacteria capable of producing endotoxins, bacteria capable of producing exotoxin and pure toxin. These are 4 types of things may be taken. All our previous prepared nozode are prepared from diseased tissue excretion of these glands. I don't know whether the proving given in a materia medica of these nozodes, whether they have been this proving has been done with the already collecting after collection of the nodule material, after giving it to healthy person and finding out the result, has been done in that way, or is only the disease affected person that taken the symptom of the disease affected person and that has been given the materia medica as proving. These are to be answered properly. These are to be reproved properly, and only after this reproving we can get good quality medicine. Pure bacteria or pure toxin are possible to isolate for use as drug substances. How to get disease, tissue, or excretion in native state? Untreated person is not possible anymore. Medication may change the very nature of the disease, and hence medicines prepared from disease tissue or excretion collected from a person who has undergone some treatment may not yield result. Proving of the preparation made by these methods may not tally with the preparation made and proved earlier. And as because of lack of information, it cannot be ascertained about the nature of the material preparation of said nodule. And the newly prepared medicines to be reproved and new. Just think what problem lies in the path of treatment homeopathically. We have to prove all these nozodes and new. We have to record how the medicines that source materials are collected, and only after doing that, new medicines will be prepared, and with those new medicines, we can treat patients. New disease-forming microorganisms are being isolated day by day. Preparation of nozode using those microorganisms are necessary to fight against those diseases, as well as get rid of their ill effects. Recently, we have seen corona epidemic. Some person was trying to prepare corona nozode. They prepared that. Think about it, Rajesh Shah. He prepared some nozode, but the government didn't allow him to use that. I don't know why. many problems, however. I was talking about nosode, but this type of reproving is also required to be done for all the medicines what we are using right now. Is it sounding something shocking? No, what I'm saying is not shocking. We shall have to reprove the medicines prepared especially from botanical and animal origin. Almost all our polycus medicines were approved some 200 years, isn't it? And because of natural mutation occurring within that long span of time, the constitution of these plants and animals has changed. So what proving it got some 200 years back, should we get those proving right now? If the constitution of the plants has changed, not only constitution of plant, but constitution of mankind has also changed in this period. So the proving result of that period, some 200 years back proving result, will that be at par with proving result of right now? Definitely not. And this is the reason what I think. Sometimes we are getting partial result with a medicine. We're trying to get medicine out of the best pharmacies, even. But even with that, we're not getting our desired result. Sometimes we're getting only partial result. The fault is not yours, as because you are following organ and medica. The fault is not the manufacturers even, as because they're manufacturing medicine as is given in the books. The problem lies in the raw material itself. What raw materials used at the time of proving, you cannot get that very raw material right now. It is possible to get even for minerals also, you may get something. For simple chemical compound, you may get same material. But in case of plants and animals, you may not get the same material. We often hear for older generation that the sabji what we are eating at old time was taste was much better than the sabjis we are getting right now. Vegetables we are getting right now. Why is happening? It is happening because the chemical constitution of the vegetables that has changed. And because of that change, we're not getting that taste again. So we shall have to reprove our medicine again, all our medicine. And that is essentially required if we wish to survive homeopathy. Otherwise, homeopathy will not survive. Previous provings on the basis of which different mathematics were written may not hold good till date. Let me give one example. Some experiment was done at Royal London Homeopathic Medical College. Say some 15 years back, two medicines were selected at that time. One was the Arnica montana and the other was Falciparum. Both are very widely used medicines. Do you know what the proving result was? The proving result says that only say hardly 60 to 70% proving result was identical with that given at the mathematical. That is 30 to 40% differs. And when the physicians are selecting medicine out of those symptoms, giving the medicine prepared right from this present day vegetables, will you get all the result? This is essentially required for homeopathy. Forget about new medicine. Forget anything. If you wish to keep homeopathy alive, we shall have to say, we must reprove our medicine. A new material has to be prepared for that. All homeopathic treatment doesn't rely on the name of disease, but relies on symptoms. Improving of these old drugs are essential to get newer symptoms, which will facilitate proper prescribing of medicine. Now let's come to another raw material of imponderability knowledge. Another problem area. We don't know how those medicines are prepared. I'm talking about from own experience. Some research work was going on at Kolani University, West Bengal. Research work was being done by Professor Kudabox, and he was using X-ray treatment for experiment. He got very good result using X-ray medicine. While writing the paper, all people shall have to describe what is the source material, how he got the medicine. He came to us, asked us, can you just say how this medicine was prepared, X-ray was prepared? So go to literature. I've gone through the literature. Literature says only X-ray was irradiated on alcohol. At that time, people didn't know that X-ray is a bunch of rays, a wavelength of bunch of rays that will be of different wavelength. We don't know which wavelength X-ray was irradiated at that time. What was the intensity of that ray? How long it was irradiated? There's no record. So how can we prepare that medicine again? Forget about all other imponderabilia, those lunas, and all those nonsense imponderabilia. X is a well-proof medicine. Yes, it works. But we are unable to prepare it new. Once the old stock is gone, we will say, no, it's not more available. We should have to research on these subjects. We should have to prepare, keeping all the records, and use the material what we get, reprove that material. Only that will give us good result. It says that drug was prepared irradiating lactose alcohol with X-ray, but doesn't say anything about wavelength or intensity of the light or precise time of irradiation. That was trying to replicate that at Jalop University. Let's wait for the result. Only then we can see that we prepared a new or not. So how can one replicate the process to get the same starting material again? Thank you, sir. Thank you. I've taken much of your time. I don't know what I have said. Does that seem nonsense to us, nonsense to ears, or is it required if we wish to keep homeopathy alive? It's up to you. Thank you. Hello.
Very useful speech today. Thank you, Dr. D.S. Bhatt. It is very useful speech today. Now, is there any question for anybody? Any question from anybody?
I think there's no question.
You may ask any question. Hello. Our who are joining in this program, there any question?
Okay, sir. Then let's stop here.